morning. I am on my own this morning. I had a cancellation of my interviewee for the day. So I just wanted to talk a little bit about women's health or lack thereof. I was having a couple of conversations over the last week with people about various issues, one being menopause, another being lactation, another being just that postpartum period of time. And the link between all of these things is that they are related to women's health. And women's health in this country, in the United States, is simply sorely lacking. We do not prioritize it. There are little pockets of where it is prioritized because there is money and lobbying for things like breast cancer, which is amazing. I'm not belittling or negating the importance of the things that we are focusing on. But the things that we seem to not prioritize are actually things that make a really, really big deal in terms of quality of life and living our lives to the fullest and being the best contributors to our community as well. So women who are supported in lactation are able to function in a way that they may not have been able to. So in terms of being supported at work and or being supported by having time off of work, paid maternity leave, that is so important in terms of getting that mother to a place where she can do a better job when she does go back to work. Women who are needing to go back to work after 2-4 weeks because they just can't afford to take off more unpaid leave, they are not going back in a good place. It's not good for them. It's not good for their workplaces. It's not good for their family, their baby. And we need to look at that and figure out how to better support moms who are new moms in all of the different things that they need to do to have the time and support and resources that they need to do those things, those family things that they want and need to do, but also continue to be a contributing member of our society by working or whatever else it is that they may do. And if they choose to be a stay-at-home mom, that is also a full-time job. And that is potentially allowing somebody else to have, not needing daycare opens up another spot for somebody else to be in daycare. There's so many ways that we are interconnected and that supporting each person to do what they want to do, what their goals are, and how they see their life and their family structure. If we could support everybody in doing that, everybody else would also benefit. So other places that we're not seeing support. So other countries have automatic home visits after bringing a new baby home. And this makes such a big difference in terms of both morbidity and mortality, meaning that in terms of morbidity, it can help to increase breastfeeding rates. It can improve finding, things that are occurring postpartum that maybe otherwise wouldn't be found. So mental health problems, maternal high blood pressure, problems with baby not gaining enough weight for whatever reason, picking up on a lot of things that may come up in those first days or weeks that a home health worker could help to support, potentially pick something up that needs to be seen urgently by a physician, and this could in turn help with mortality. So there is a high rate of maternal mortality that is related to mental health, as well as other problems that come up and go undiagnosed because there are no close follow-ups after a baby comes. Unfortunately, they're not supported by insurance reimbursement or by physician schedules, and certainly home visits are not supported and are not a regular part of postpartum care. So that is another place that we could be supporting better. And then flipping to kind of another part of life for women is menopause. And menopause has been really ignored. There is research out there, but people do not necessarily follow the research and evidence in their practices. There's a lot of fear mongering that affects people's treatment of menopausal symptoms and menopausal um, conditions that typically occur. So thankfully, there are more people now getting the word out about different things that happen during menopause and different ways to treat those things and how to find the care to support you and make sure that you are treated appropriately and cared for appropriately during that time in life that, most of us, I'm perimenopausal and I don't even really know what to expect. Nobody really has talked to me about this in terms of, not my doctors, but also even as a doctor, I did not learn about this in my training. And, how many women are we serving poorly by physicians not getting the education and not having the information that is out there for women to take good care of themselves and advocate for themselves during this time of life. So those are just a few places. I know that there are many more, and I could go on about how we also do not prioritize children and their needs, their educational, as well as often physical and mental needs. But I'm going to leave this for Women's Health Today, and just some musings that I would be very interested if you have thoughts on the issue, either ways that you've been affected by this or ways that you have worked to change this in our system, or just thoughts and musings that you'd like to add. I would be very interested in reading comments and having further conversation about this. So I hope you all have a wonderful Friday and you all have a wonderful weekend. And we will see you again next week on an interview for our weekly episode of Keeping in Touch. Bye-bye.